I am your facilitator, Dr. Kayce Solari Williams. I am, I'm going to read as if I don't know myself. I'm going to read so I don't just go off on my own little tangents. I've taught at the K through 12 and higher education levels. I've been a dance and physical education and theater teacher in Aldine, Fort Bend, and Houston ISDs. I am currently a clinical assistant professor at the University of Houston in the Department of Psychological Health and Learning Sciences. I'm the co-owner of Be Well Health Resources, LLC. I'm a co-investigator on an NIH-funded Cancer and Health Disparities Research Training Grant. And I am president of the American School Health Association, as you can see from my little title there. Also joining us is Principal Keli Mullins, who has more than 17 years, and please wave for the people, 17 years of experience in education, and has served as a teacher, assistant principal, and principal. And like I mentioned in her introduction of her name, she is currently serving as a high school principal in San Antonio ISD in San Antonio, Texas. We have with us Lindsay Titus. Lindsay is a passionate, influential educator specializing in the field of behavior analysis. And with experience as a classroom teacher and a behavior specialist in public school, residential, and private settings, Lindsay shares her passion through her experiences to guide, motivate, and encourage others, educators, to do the same, to use their own personal stories to create connections and relationships with others. And wrapping up our panelists, I was making sure I didn't miss anybody. Wrapping up our panelists list is Loretta Williams Gurnell, who is a STEM influencer. Yes, I said STEM influencer. I love that. She's also a leadership strategist and education nonprofit consultant. She is founder of the Super Lady Network, benefiting the SuperGirls Shine Foundation, for which she serves as the executive director. Welcome all of you. Detailed information about their bios are on the event page about each one of our panelists, but I want to be quick because I want to get right into all of the questions. And I'm going to do my best back and forth like you also to look at you and also get you all the information. All of you weren't with us throughout the entire day, but I want to kind of bring some things together for the day and how we've gone through. We were greeted by Commander Sauberschatz early this morning. We went into our talking about safety and for staff and students reentering the schools. And I'm sorry, let me be, that's right, did I say it right? Re-enter? No, reopening. I'm sorry, look, I'm getting my language right, I got a new vocabulary, I typed that up. Reopening schools. And with panelists from Dr. Garba and from EPA. We also had a superintendent on the line, and then we moved into active intermission, which we had a lot of fun there. And then we went to talk about coping. And some of the overlap from this conversation that we'll talk about with student success is gonna come, and I think some of the questions that I saw had some overlap as well. And so I'm gonna direct, like I said, some questions first to you, Dr. Love. And then, you know, and I know trying to be mindful of your time, if there's any other, you know, parting moments or words that you want to share with us, please do so before we move right along. One of the moments that I saw coming through was your phrase of compassion over compliance. So then how do we measure success if we are not being compliant with some of these guidelines or metrics, or, you know, that compassion piece is paramount? Then what is a suggestion, or what is something that can be done to still meet those measures of success, if you will?
Yeah, I think that's a really great question. And I didn't say that. That was the Secretary of Education for the state of Georgia. He actually said that we need compassion over compliance. And that would really hit home to a lot of teachers, because that came from a state official. But I think what we should be doing is thinking about, do our standards even have compassion in them? And if they don't, then how can we ever live up to those standards? And so I'll give you a really quick example is New Zealand. New Zealand said, we're going to redo our budget and not look at growth as far as money. We're going to look at wellness and make that how we understand our economy. So we're going to just do away with all the measures of growth that we think, and then we're going to redo our economy and put happiness and wellness and safety as a way to grow our economy. And they redid how they understand their budget. And so I think if we're going to think about compassion over compliance, is to say, do we really have compassionate standards? And if we don't, why? And if we really want to be about the ideas of compassion, well, we need to do away with those standards and get standards that align to the ideas of compassion moving forward.
Someone said in here that, you know, more people like the folks that have been on the panels today need to be in these decision-making, you know, spaces. And so you all know, several of us are. So that's the good news. We just need to, again, this is why we're another one of those whys. When I, you know, introduced the why in the welcome this morning, why we're doing it, this is one of those whys. So that it's not just the few of us who are helping make those decisions. It expands beyond, and you all advocated whatever place you hold in supporting the school community, you advocate for the success of our students. Marci, to you, there was that request for some step-by-step strategies to help. Yes.
This is Kathy. I had a question follow-up to Dr. Love, because with the ESSA
Act.
The Every Student Succeeds Act, the idea of that act was that we are going for a well-rounded education, and that states were all supposed to come up with these other ways that we're going to say this is how we are having a well-rounded, kind of building on, like, without saying the whole child model is kind of like what it felt like, and it didn't happen. So we're 5 years into that act now. So Dr. Love, can you help us as advocates use that language, that federal regulation in our state and local areas, and what are the ways we can do that?
Yeah, Kathy, no, thank you for that. I think a lot of times we have policies that have really good intentions, but intentions and execution are not the same thing. And so I think many times we have to think about why these policies don't work, even though they have all the good stuff in them that we think. And a lot of it has to do, number one, with funding. And number two, we haven't gotten to the idea that every child deserves this fundamentally. And so even though it's a great policy, when we implement that policy, we're not all in agreement that every child deserves this type of learning, this type of experience. And so I think we have to also make sure these policies are doing the work of anti-racism in the policy, before the policy. So when the policy rolls out, we've also talked about the anti-racist work, which means that no Black person or brown child is disposable. And if they're not disposable, that means they are encouraged and they deserve healthy eating, playtime, all of these things. But like you said in your presentation, who gets punished the highest disproportionately for recess? It's Black boys, which means that we haven't done the work of helping our teachers and our school leaders understand how racism is perpetuated every day in our schools. So no matter the policy, if we don't do that work, it will fall on deaf ears. I mean, we are living proof of Brown versus the Board of Education right now.
There you go. And to add to then, Kathy, thank you for that, because I did miss one that was directly for Dr. Love that was in the chat. Was a school nurse has asked how they can approach administration towards putting out a message and having it be more than, I don't remember who said it, more than a poster about, being anti-racist. What is it that can be to actually have the conversations and begin to parse out those policies and what they should look like? How can a school nurse approach the, because that's the thing. It's like, goes back to what I said. It should, no matter what level we are or where we sit on the WIS model in our contribution to school wellness and school health, how does a school nurse have this conversation with an administrator? And then I'm also going to take this over to you, Principal Mullins, because I would want to ask you, how would you want your nurse to approach you? But first, it was directed at you, Dr. Love, so I'll give you an opportunity to go, and then I'm going to lobby it over to Principal Mullins.
I'm curious what Principal Mullins is going to say, but I'll just say really quickly is that I think no matter your position in the school nurse, the school therapist, I think you're very fortunate to be a school nurse. I mean, that's one of the points I was going to make. You know, how do we open up schools in COVID when many schools, the school that my kids go to, they do not have a school nurse at all? But I think no matter your position, we have to remember that it's about a full school body, all the people in that school working toward the ideas of justice. And so I would say, no matter your position, organize, have book groups, have study groups, ask questions, get organized and think about how you can make, you see something that you don't like, you see these certain amount of kids getting suspended and these kids not getting suspended, even though you're the school nurse, organize. Start to ask those critical questions. Start to understand what's going on. Hey, I'm kind of noticing some trends here, and I have some questions about those trends. And I'm sure there are many, many teachers too that also have those same questions around those trends. Organize, ask questions, and try to dismantle. And the last thing that I would say, if anybody's interested, the Abolitionist Teacher Network, these are the things we're trying to take up right now, is to implore people in schools to become organizers and to become radicals and think about how they can dismantle these structures in their own communities and schools.
Thank you. Principal Mullins.
Yes, thank you. I'm going to start out by saying everything begins with relationships. You do not get meaningful work until you have meaningful relationships. And as you build those relationships, that burden begins at the top with the principal. The principal must build the proper relationships with their staff members, and as that facilitates throughout the staff, and of course it transcends to the kids. What is most important is key is collaboration. You have to have those professional learning communities on the campus. You have to meet with everyone. You can't just meet with the teachers about the kids. You have to include the nurse, the social worker, the counselor. Everyone must be on the same page. And that's the importance of professional learning communities. On many other campuses where I've served, it's a weekly meeting. And everyone has a voice in that meeting. That is not a meeting that is led by any of the administrators. That meeting is led by the teachers because they create that conversation. And as they create that conversation, then everyone begins to feel like they have a voice. They feel comfortable to say, you know, Ms. Mullins, I'm noticing a trend here. So I have this particular student that has this stomach ache at 2 o'clock every day. Well, typically the child does not have a stomach ache. The child doesn't want to go to a particular class because they feel like in that class, that's where they're targeted or that's where the suspension comes from. So, you know, that's when you piggyback on the presentation that was given by B. Love and a couple of the other presenters earlier, that we have to make sure that everything is equal across the board. Brown, black, white, everyone is equal, and that each child deserves, everyone on that campus has the same mindset, that every child deserves a quality education. And once everyone's on the same page, and it takes work, I will tell you, because that work begins with the administrators and then it transcends throughout the building.
Absolutely.
You know what, Kayce, may I jump in there real quick?
Of course you may.
Well, the reason I did, and B Love just got off, is because she was talking about she was talking about equality, but she was talking about the inequality of finances and resources throughout the school for Black and Brown schools. And that's particularly where I fall in with STEM. So here we are. We already have schools that are already Title I schools. They're 93%, they're on free and reduced lunch. And then coupled with that, they don't have the technology, and then we're introducing STEM to them. Can we just take care of the Maslow's needs first? Can we just take care of their basic needs so that we can actually get them to school? Once we introduce them to these STEM programs, then they are able to think outside of the box. They're actually able to get certified and degreed, and all those things are nice. But one of the things that what I'm seeing here as a community partner is that if we don't get the proper funding, we're going to have there's still increases of disciplinary infractions. We're still going to have the absenteeism in school. We're still going to have kids not being able to be engaged because of family. Those family disparities that are happening in those Black and Brown communities prior to COVID-19. So my desire is not to just work with community partners like the chambers, but work with the district attorney's office. Why? Because we've got to get the funding so that we can get the change, so that they don't become juveniles in the system. And that's the problem, is that if we can be proactive versus reactive, now we can have these learners turn around and be able to help their families, because now we have these continuing education programs where their families can go to these HCCs or the San Jacks and get these tangible norms and all these skills for them to be able to change the socioeconomic status that they have. And so, yes, we do need the funding, but we've got to be more proactive. And we've got to make sure that not just we have our nurses and our teachers in these conversations, but we've got to have these community partners in too, because now we can get industry in the schools helping with the funding. We can get local businesses changing the taxes for the schools and get them involved. And now you won't have these poor schools operating with lesser budgets. I
love your perspective from a community partner point of view. I would like to go across the panel and from your lens, and I know each of us wears multiple hats with as it relates to the school system, right? So from your lens in your professional life, from your lens as a parent, if that applies to you, from your lens as just a product of a public school at this point, if you were to think of yourself into this new reopening in this midst of COVID, if you will, what is for you a major area of concern and a tool, or at least a nugget of information or wisdom that you could provide to those watching as we prepare to reopen schools? I'll start with you, Marci. We'll just go in order of the introductions.
Somehow I knew you were going to say that. Thank you so much. I think that's a really important question. And thank you for this panel. I learned so much from the other presenters as well. So I'm thinking as a school health person, and then also as a parent of a 6th and 8th grader, I think my biggest concern is the uncertainty and the constant going back and forth of opening and closing. The variation, I think, is something that I am concerned about. Something that I think is positive is I did see some effort across school districts and in my kids' own school to actually connect with my kids at a different level that they had before, to actually check in with them and see how they were doing and have a discussion about how they were. And I think that mental health now and the importance of that and those basic things that Loretta was talking about, Maslow's hierarchy of needs, that people are paying more attention to those things now than they may have been previously. And I feel like people are more engaged in the school system as well in dialogue.
Thank you. Kathy, same question.
So I think it's what are my concerns and what are the positives? Is that right? So
well, that is what, just from your perspective, what are some things that, I mean, with all of it, thinking about Dr. Ginsburg's perspective, from all of it, let's find the opportunity. Even a message echoed with Dr. Love in this presentation. Let's find the opportunity so we don't go back.
Right. So I would definitely echo that. I hope not. And I think the concern is, I'm going to echo Marci here, and I think it's something we're all feeling, and Dr. Ginsburg mentions, it's this uncertainty. It's the tiger hiding in the wilderness, but we need to talk. We need to speak what's happening. We need to share those feelings. We need to share the concerns. We need to, I love the idea of the school nurses coming together, and I love that that Keli Mullins has created a space for her staff to do that, and then they don't feel alone, because that's too often what happens, is that people feel alone and they don't want to voice because they think that they're the only ones that feel that way. So I think that's been that's both a concern, and I feel like there's been such in some ways, because we've done some more of this, people are more comfortable with this platform and have connected in other ways. And I would also say to the people who are educators, that have been through this, there are so many good things that have happened, like teachers reaching out to students and staying connected and using tools that they didn't even know they could use. And I think the idea that companies have stepped up and provided laptops and internet connectivity, and I think it's really cracked open all these things that we knew were there, but nobody wanted to talk about. Like $23 billion funds difference is outrageous. And nobody thought that was weird. Nobody thought to ask. Like, now we're asking, like, what the hell's up with that? You know? So I think that's the positive, and I think that's all the concern I share is, you know, school's going back 2 days, 3 days, some of the kids these days, some of the kids that day. How do you do that as a family? How do you do that? You know? So I think we all need to start talking, and you know, compassion is going to be important. Self-compassion and compassion for each other.
Totally. Principal Mullins.
Community partnership is important. You've got to bring them to the table. I've always served on Title I campuses, so community partnership has been beneficial for me, because when I go out into the community and I include the community, then guess what? They don't allow the students to hang out in the stores, or if it's the corner McDonald's, if it's the taqueria, they don't say anything to them a lot of times. They pick the phone up and they call me. And then we can just send someone there and redirect them back to school. And then once a child knows everyone's on the same page, not just my mom, the owner of the store, correct. And they all have a benefit. But then also what's great about that is that those individuals, they send items to the campus. Hey, when you're having a staff meeting, stop by. I would like to give some donuts to the staff. And then the teachers go in and they patronize those businesses and they tell them, thank you. We are a community. The school should be a part of the community. And that is critical in the lower socioeconomic areas. It is critical because then everyone is on the same page. Remember now, those businesses see the kids on the weekends when the educators of that building don't see them. So they have more of a perspective. I've been in a situation where I've walked into a business on Monday morning to patronize it for myself. And they say, you know, your kid, so-and-so, yes. Well, they had a family emergency. The parent hadn't even notified me yet. So now I know when the kid arrives, I can take the kid and we can start the social and emotional. That is very key. That is something I'm very passionate about. I stress that now to each and every educator to please have a social and emotional just section and part of your daily schedule. Trauma has taken place in the world. There's no other way to describe it. This has been traumatic. For some that may not have had anyone in their family or friends that have been positive, but some have. Just being at home for some, it's been. Parents aren't working, food is limited, bills aren't able to be paid on time. There have been relocations that have taken place. If you think that the district where your child is in has been transient in the past, pre-COVID, imagine what it is now. We are meeting now about the re-entry of schools, and just to go back in, we have just numerous of children that are new coming in. So that's social and emotional. We've got to wrap our arms around them, and that must be done before we can begin to speak about English, math, or science.
Absolutely. Lindsay, I know from your perspective, it may be, how can you support other educators in equipping them? That may be the perspective you take. Please speak to that.
Absolutely. I think one of my, from a behavior standpoint, behavior mindset, it's really understanding where we are in the present moment, what our understanding is, and if fear is part of that, know that that is absolutely okay. It is absolutely, I think one of to me, it's a pro and a con, all these emotions that are surfacing. And when we listen and lean into those emotions and have conversations with our staff, with our family, with our students, we're able to bring that to the table and really say, this is how I'm feeling and this is what I'm thinking. And I love that because it provides that preventative phrasing. And so it's opening up that conversation with your class that these are my ideas, but these are mine and I want to know yours. I want to know our ideas. What can this year look like, regardless if we are virtual or in person? I think one of the best ways to make those connections with, whether it be adults, whether it be with students, or honestly with ourselves, is one of the strategies that I've kind of used it, but didn't know the name. And it's ultimately having 100 conversations about nothing. And so it's just having conversations. Start the talk, get to know your students, get to know one another inside and outside of school. And I think something that really relates to what we've been talking about here today is, I like to say that strengths lead to our solutions. Focusing on our deficits is going to lead to resentment. And so as we're looking to really increase engagement, we're looking to increase, just this getting back into building our momentum of what school can be and what we're going to change it to be. It's really looking at where are those strengths and bringing in the passion projects, bringing in the open opportunity and personalized learning so that students can show mastery in a way that aligns with who they are as a student, and you as an educator get to bring in your creativity to align with who you are as an educator.
So thank you, Lindsay. From the community partner perspective, Loretta, will you share with us, in addition to this, concern or positive moment, but also for those places that don't have these relationships, this connectedness, this openness to the community partners, or just this culture that's been established, how do you foster that? What do you do? I mean, I know you've never met a stranger. I know that's part of your personality, but what are some things that you can recommend to maybe that's not that person, right? And they don't have that necessarily that gift that's outward. It may be deep inside, but it may not be outward. How do you approach that? And what do you recommend? Oh, you're muted. Stop you before you get going because she says good stuff.
Thank you. Okay, here we are. So the first thing that I would recommend is that just look at me. I'm a lady. I'm a wife of a basketball coach who's an educator, and I'm a mother of 2 dudes in middle school and in high school. So I think having that role first and then coming as a community partner lets them know that I get it. Like, I get it. I understand everything that you're going through. I'm living it. I'm breathing it. It's real for me. It's very real for me. And we're having these real live conversations because as a wife, I'm concerned that my husband goes back in the classroom. I'm definitely concerned that our children go back in the classroom. So as from a community partner perspective, I would say is the first thing is that we've got to be willing to go in and offer an ear to listen first of what is really going on in the classroom. I think as community partners, I'm not saying all of us, but sometimes we lead with the service, and we shouldn't lead with the service. We need to understand what the demographics are of that school. We need to understand the culture of that school. We need to understand the challenges of that school, but then we also need to be able to listen and find out what are the goals of the school? What are the 2-year goals? What are the 5-year goals? What's the heartbeat of the school? What are some of the wish list items that they have that they want to be able to fulfill in the next 6 months, 12 months? And as a community partner, I need to be willing to be that community partner to bridge that gap. So if I have relationships with industry, or if I have relationship with university, or if I have relationship with small businesses, I've got to be the one that comes together and say, you know what, let's do this together for the good of the students, for the staff, for the community. And so that's a real big piece for me, is bridging those gaps and coming together. The second piece I would say is sometimes you have to be adaptable in order to create this change. So that you have to go in not with this a rigid program, if you will, because we have programs. Of course, SUPERGirls Shine Foundation has programs for girls 10 to 17. We cater for elementary, 5th graders, middle school, and high school. But that's not always going to be the best program, maybe specifically for the modules for that particular school. So once we go in, we have this fact-finding meeting with the principals and the counselor, because we have that team approach. The counselor, our lead liaison, who's going to be the person in that STEM area. It's going to be a parent who's going to be a part of that team, as well as a student, so we can get that group. Once we have those conversations, then we can determine, okay, what's the best program modules for this particular school? So the third thing is listen. So you got to lean in, you got to listen. You got to listen well. You've got to be willing to be adaptable. And then you also have to be able to willing to close the gaps by bringing in resources, because teachers, don't have time to do that. Administrators don't have time to do that. But if we're going to make stronger schools, we've got to have stronger communities. And once we build those communities, we have a better economy. And once we have a better economy, now we have options for our youth to go into to become better citizens and actually make this money in STEM.
Absolutely. Thank you all for sharing all of that for that particular question. I have so many. It's like, where do I even begin? They keep coming in. So for those of you all who are putting in your questions, if I don't get to them because there's hundreds of you popping them in, well, maybe not everybody typing at the same time, but they're coming in. I will also encourage, if there's something directly addressed to you on the panel, please feel free to respond to all so that everyone can see, so that we do try to maximize as many question responses as possible. And I do want to move this question though forward to Kathy and Keli. How to, and then anyone to chime in, but specifically in the schools, how do we make sure that all students have a quality experience this year and are still feeling successful? I know you can't speak for what that's going to look like across the board, but what are some things that we can put in place? And Kathy, more specifically, someone was asking on the recess component, that outside time, can you bring in a little bit of a safety mindset, not just the opportunities and what those different skills and things, that resources that you're going to share, the list of games that you're going to share, but what's the realistic safety components? And so Keli, for your lens, what is that going to look like in the classroom? I say that loosely because the classroom will be fluid at this point, right? So if you all please answer that, and I'll start with Kathy, please.
You know, class size makes, you want to go, Kathy? Okay. Class size, campus size makes the difference. Because, and I'm starting out by saying that, is because I think it's important that you meet with the parents. So if you're on a campus that has 2,000 kids, then of course we're going to probably have to go to surveys. But you take those surveys and then you look at them. You just don't deploy them out. You've got to go through all of them. And then you can group them, and then maybe you can divide them out amongst the administrators. The nurse take a pod, your counseling team takes a pod. Maybe your behaviorist and your specialist take a pod. If you're on the smaller campuses, then you can make some appointments with the administrators. If you know your families, then you know which ones are more comfortable, want to talk to the principal or the assistant principal, or maybe they've built a relationship with the nurse because the child has a daily medication routine. You've got to ask them some simple questions. How are you doing? How's the summer been? How did the summer begin? Where are you now? Are you employed? Do you have food in your cabinets? Do you have transportation? We've got to go back to the basics, and you've got to take time. That's what those conversations should be taking place now with parents. There's no time schedule. It is picking up the phone if it's 6 o'clock in the evening, you know, and having those conversations so that you know. You've got to know where Johnny is when he's coming back to school. You've got to know where little Keli is when she's coming back to school, because those are two different households. Have you been out of the home? Some parents have not taken their kids out of the home. Some are scared to death of COVID-19. There are some that have found a way to say, okay, this is the way we're going to sanitize. This is the way we're going to wear a mask. We went out, we have 50 masks. Guys, the clean ones are in this basket. You know, put your dirty ones over here. They've set up routines in their homes. And maybe for the 4th of July, they went to the beach. So now we have two kids that have two totally different mindsets of COVID-19, because our kids are paying attention to everything that we're doing, how we're handling it. So when you are sitting and looking at CNN all day, folks, all day, and you're saying, oh my God, did you hear that tragedy? Oh my goodness, this one, your kids are taking on that. Those emotions are just, that energy is just transferring over to them. So we may need to pull back a little from that especially if you're in a situation or your district has given the option of returning to school and you need the child to return to school for childcare, so that their little minds can be clear. And when I say little minds, I'm not speaking of K through 5. I'm talking about the middle school. I'm talking about the high schoolers, because everyone has a different perspective. So again, it's relationships. I'm just huge on those relationships. I'm huge on the social and emotional, because if you build the right relationship with your parents, then they do not have a problem coming in, closing a door, and letting you know. Life has been just a mess for us. We've lost this individual. These 2 individuals were diagnosed. I'm just starting back to work. So then you know where your family engagement team needs to be deployed to. I think it's important that we're going to put the paperwork and push that aside for the counselors, and we need to go back to the basics with them. We need some grief groups taking place. We need to revisit bullying, because as we come to school in mask, some are going to have the disposables on, and then some are going to have the super cool ones that mom was able to go out and buy, or maybe there was someone in the family who could sew well and made them. So we've got to revisit the bullying. We've got to bring our kids back together and make sure everyone's on the same page.
Yep, the chat is speaking from my nods. Okay, Kathy, I will pass to you.
So thanks, Kelly. I agree. It is the relationships. And I was taking notes while you were talking, because I wanted to kind of connect a couple of dots that we've talked about throughout the day. I don't think anybody that's in this presentation or been a part of our webinar today or been a part of our conference or any of the presenters has said, oh, we need to catch our kids up. But it is something that's a sentiment out there in the world. Like, oh, we've had this gap. There's been a loss. We got to catch everybody up so we can get back where we started. And I think if we're looking at success, I think Kelly's idea that you have to see where these children, these families are coming in, and they're going to have a variety of experiences. We're not going to be able to expect that, okay, you came in, you left school as a 3rd grader, and now you're coming back in and wait, oh, you should just be right where you were going to be if you would have been here and you did all those standardized tests, because those always teach you so much. And now we're going to jump right in and just jump in and launch into 4th grade. I think we all need to take a step back for ourselves, to follow Dr. Ginsburg's advice and practice self-compassion and look at all the balls in the air and say, you know what, a couple of them dropped. I'm not going to be able to pick them up, and it's okay. I need help. You need help. We can be stronger together with pretending we're all the little sticks. I also love the way that Dr. Love talked to us about we've got to challenge the normal. Nobody wants to go back to the normal, because we all know it and recognize it's broken. So how do we set ourselves up to be successful is to recognize that it's broken and to welcome kids in, and especially in those schools that don't have a lot of space, how do they do that well? And then when we look at, I think something that's important is relationships are important, and bullying and all these things about social emotional well-being are essential to being ready to learn, and recess is one way to get there. Play is a way to get there, but we have to intentionally teach our children and model empathy and compassion for ourselves and for each other. And we need to teach this to our children, just like we teach them how to hold their pencil, and just like we teach them how to do math, and just like we teach them that, you know, going is a gerund. I don't even know if that is a gerund of whatever, it's a verb, so that we are being real about where and how why school exists also. Like, we're here to learn and grow, but it's about having young people, little people, turn into adolescents, turn into adults who are well adjusted and able to function with each other and for themselves. And I think that's the real opportunity, and we can do it, but we have to all be together and be okay to say we're not okay, to use Marci's. I think it was Marci. Somebody said it along the day. So
yeah, and I want to go back to Keli on something. Yeah, I will. Thank you, Kathy. I want to go back to Keli on something, because someone is asking about the involvement and the inclusion of social workers, because we know that is something that is heavily utilized or underutilized, or you know, you can help me help us take the pulse of what your experience is from that regard, and then anything else that you'd like to add to the conversation.
Okay, when I mentioned the family and engagement team, those are our social workers. That's the name that the district has for them. So they are very heavily involved. They are assigned to our campus. Some of us share them with another campus. It just depends on campus size. But I definitely utilize my social worker, and she's great. So I definitely, everyone has to be in. This is not easy. It wasn't easy pre-COVID. We know it's not easy now. Everyone must be involved. There's no way that anyone can be left out. I saw something in the chat that I wanted to touch on. I believe someone mentioned something along the lines of speaking to the parents who have children with pre-existing illnesses. Absolutely, absolutely. You have to make those parents feel secure in returning their children back to campus, especially those children with asthma. You must. Now, should everyone feel secure? Absolutely. Depending on your school district, depending on your campus, how those measures are set up, that may look different. I would hope that there's some form of uniformity for us throughout our various states and cities and regions. But I think that is very, very important. Being a special education educator myself and working with children with disabilities, that's a hot topic for me, and it's also a passion of mine. It is very important that those needs are addressed and that those parents feel comfortable. Okay, so when is the mask going to be on? How long is the mask going to be on? Will my kid be able to be outside? Is it possible that they can be educated outside? See, for me, I think this is awesome because there's no cookie cutter, and there's always a cookie cutter in education. We arrive on time. We have certain restroom breaks. That's even for the staff, for those of you that don't know. We're on lunch duty, and then we have lunch, and we have to go to this meeting. What is awesome about this is that that's all out the window. That is all out the window. The first thing is safety. The second thing, for me personally, is the social and emotional. Let's just find a way to get the kids in the building where everyone feels safe. What does the bus ride look like? Are we every other seat? Are we every 2 seats? We'll let siblings sit together. Other than that, we're every other seat. So that means extra routes. Once it arrives at the campus, what kind of measures are in place where a parent can feel secure returning their child to the campus? Have we limited the visitations coming in? Have we gotten with the staff and say, hey guys, we are gonna have to hunker down if someone has to be absent. Let's work together with each other so that we don't have the substitutes in the building. So that limits the traffic. What does the cafeteria schedule look like? While it is still nice outside, if the heat is down, because of course I'm in Texas, so today it's 105, but when that heat is a little less, can we sit outside? You know, do we have some type of plastic tarps where those are easy to be cleaned with the cleaner? Got to think out of the box right now. So to get the kids back in, but most importantly, so that the parents feel safe and know that when their kids are, the risk is as less as possible. And then we'll work together with the homes to say, well, when they arrive home, maybe these are some steps and these are some guidelines from the CDC that we can all follow. Are we going to limit backpacks? Are we going to now require plastic backpacks? And if a family can't afford it, are we going to provide them? So they're just various things. The conversation just goes on and on.
Well, I have so many other questions for you all. Our time, I cannot believe this day has flown like this. I have too many, but just know this, because I'm seeing some of the questions and someone just popped up and talking about training for the staff. That was one of my questions for this panel. So that everybody knows, the panel does know I have some questions that I'll give to them as follow up for them to give responses back. So we will give us a minute. I said earlier in the day, give us some, a couple days, a couple weeks maybe, to get this all compiled together and give them a chance to really respond completely. We will have resources for you all. There's so many things that we want to have everyone in that, like you said, that family engagement. That's that part of that OISC model that we started the day focusing on. We have continued. It is an effort by all. Every person affiliated with the school community is integral in making this reopening, as my new language from Beloved has been given to me. So as we move forward with whatever fall is going, this new academic year is going to look like, I thank you all for sharing your time and talking about what success is going to look like, the utilization of partners, maintaining that connectedness, remembering that successful, focused, productive, aptitude, achieving, and rising to the occasion children are those who are given space to run free play in a safe way. And so that if we can recognize those behaviors that are out of component with, not recognizing our true feelings, we can know how to focus on that as a team. And that includes our community partners. And so everyone here represents that. And to Dr. Love, who had to leave us early because of a time conflict, remembering that message, remembering that, it is about so many different people. This has brought to light so many different issues that have always been there. This is not new. We've known that there were issues in our systems, in our schools, buildings themselves, the environment, all of those things all together in one. But we, as a collective, everyone here and everyone that you can reach beyond with your network, we can help our children be successful moving forward. So thank you to this panel.